battling really tough times. And you talked to one of those who benefited from this.
I had an opportunity to sit down with a patient who's 18 years old as of yesterday. Happy birthday, Jenna.
Happy birthday.
Yes, but she's a part of the Thriving After Cancer program, meaning that she's recovered from cancer, but the hospital is still making sure that she has excellent care. Here's Jenna's story.
Marissa, the magical bird, she'll grant all your wishes, just leave the words.
On the rooftop playground of Rady Children's Hospital, 18-year-old Jenna Sawa remembers all of the riddles and where to search for the hidden eggs. A few years ago, she spent a lot of time here.
My mom noticed I was turning yellow over the past 3 months, and she said I've been sleeping a lot.
This photo was snapped just 4 days before Jenna was diagnosed with cancer.
I was only 11 years old, so I didn't exactly know what cancer was, but I knew it was a thing.
That thing turned out to be leukemia, and it changed Jenna's life.
I do not like pain, and I've never been able to swallow a pill. So I'd always get the nurses to play little games with me, and I would use the toy box too to help me with these pills and needles.
During lengthy stays in the hospital, there were lots of pills and plenty of pokes.
This is my favorite necklace.
Each step along the way was marked by a bead given to her by her doctors and nurses.
Every accomplishment you go through, you get to check it off and you get a bead. So every time you had to get a needle, they'd give you a red bead.
Now, cancer-free, Jenna is still checked on by her doctors and nurses, like oncology nurse Amy Schneider.
Our goal in the Thriving After Cancer program is to make each patient feel as important as they did the day they were diagnosed.
The Thriving After Cancer program allows the former patients to continue to have comprehensive care, nutritional help, and support.
We want to make sure that they are living their best life. That's what we're doing.
Thankfully, the vast majority of children who are diagnosed with cancer are going to be cured.
Pediatric hematologist-oncologist Dr. Dennis Kuo says for many of his patients, the diagnosis is life-changing because once cured, they often want to pursue a path in medicine.
And it's really endearing to see how cancer has made people stronger and also been, in some sense, life-giving to them despite the challenges.
For Jenna, the challenge now is studying for final exams. She's a college freshman and hopes to study medicine at UCSD. One day, she hopes to be back here again as a pediatric oncologist.
I do have a story to tell. Before I was what am I going to do with my life? And now I know what I'm going to do.